All right, good afternoon, everybody. Hope you had a good football weekend. Here are Paul and Josh and Lisa Tepper-Bates from United Way. I'll tell you why in a minute. I think you know why. First of all, the daily summary. This is 3 days worth of numbers. I think most interesting is the positivity rate is staying fairly low, 4.7%, 5% or so over the last week, 6% the week before that. You see some stabilization there. Hospitalizations, again, a 3-day number, staying relatively stable, and fatalities, 92. This says a couple of things. It says here we are 3+ weeks since New Year's Eve and Christmas holidays. We worried about the spike. We have, I think, weathered that spike. We've got schools have been in session 2 to 3 weeks, and there's some stability there. Obviously, universities are coming back right now, so we're watching that. There is a black cloud, and that is the fact that we have 4 more folks who have been deemed infected by that super infectious UK variant, United Kingdom variant, similar to what you see coming out of South Africa and some other places. That makes 8 in total. We knew it was here in this state. We knew it was here in this country, but now we are slapped in the face by this fact. So it's a tale of two cities in terms of our stability, making pretty good progress, hopefully bending the curve, and what I see over in Europe. In Europe, where they've got that UK variant, as the name would suggest, and you see renewed lockdowns in France and Germany, not to mention the United Kingdom. So which way are we going to go? The next chart reminds you that this is a race. We are racing to get as many people vaccinated as quickly as we can ahead of what could be this super contagious strain. And that's what we're going to find out. So far, with what supplies we have, we're doing pretty well. Still ranked in the top 5 in the country. 27% of the people 75 and above have now at least received their first dose. You know what a difference that means? If there's about 270,000 total folks 75 and above, you know, we're making a big chip in that. And probably over the next two plus weeks, depending on our supply of vaccine, that incredibly vulnerable piece of our population will be taken care of. You know, total doses administered, 300,000 and counting. And I think that is progress. But we have 2 issues now. One, we got to make sure that you understand how to get access to this. Next chart, Max. Working with our friends at United Way and Lisa, you know, they've added 75 more staff to their call lines. Their call lines are burning off the hook. Lisa said it's something like 5 times more than they had just a month or 2 ago. Partnerships with the senior centers, making it easier for you to figure out how you can get vaccinated. 75 and over, by the way, just 75 and over. So senior centers are now empowered to call out, help you either make a telephone reservation or even better, they will get you on the VAM system so you get that appointment going forward. We're working with CDC, the Center for Disease Control, doing what we can to make it a little easier to access VAMS, which is the vaccine management system. We've heard it's complicated, especially for older folks. We're working on that as best we can. And finally, this map you see here does not do justice to this interactive map, which we have set up either at 211 or you get it at a ct.gov COVID vaccine. Put in your zip code, find out where the closest access to vaccinations are for you. They'll also be able to tell you exactly how you sign up for the vaccine, whether that's a Hartford Health or that's a van type of integration. So we're trying what we can right now to make it easier. There are about 120 plus sites across the state right now. That's the good news, but we still need more vaccine. And this number sort of says it all. We get 46,900 doses every week. The good news is last week they gave us an extra 50,000 for good behavior, so we were up at close to 100,000, made a big difference there. But on average, we're doing less than 50,000, and our providers, the hospitals, community health centers, all are requesting well over, actually, 150,000 doses every week. And that's where the disconnect is. That's where the frustration that, Lisa hears on the phones at 211, and how we have to do everything we can if we're going to win this race against the super contagious variant. This is what we've got to do. And I'll tell you, given the ambiguity out there between the vaccines, the relative stability, where we're going, and yet we still have a 5% infection rate, and yet we still have the risk of Europe and what you could see there in terms of a flare-up, given the fact that the end of our emergency powers ends on February 9th. Paul and I have decided to formally request of the legislative leaders that we get our emergency authorization extended a little bit longer, till April 20th. April 20th, where do you come up with April 20th? We think by April 20th we're going to have a really good handle on where we stand in terms of vaccinations, where we stand on supply of vaccinations, where we stand on bending the curve, where we stand compared to that super contagious variant of the germ that's out there hitting us every day right now. I think that'll be a very good time and good conversation with the leadership. In the meantime, if they have any particular executive orders that they take exception to, of course, they can pass their own bill to deal with that on a one-off basis. So I'd like to think that by middle of this spring, we're going to be much closer to normal order when it comes to A, our lives, and B, working here inside the Capitol building. So finally, before I introduce Lisa, protecting our most vulnerable. We take this really seriously. I know, healthcare workers, frontline, nursing homes, 75 and above. You want to know who's eligible? It's not that complicated. It's 75 and above. But we do have a special a prioritization for those in congregate settings as part of the overall 1B. I'm really proud that I think Connecticut is one of the very first states in the country to fully vaccinate a homeless shelter, one of our first congregate settings going forward. It's not going to be overnight. We've got an awful lot of people in 1B as we phase this out. And in the meantime, Lisa Tepper Bates and her amazing group at United Way are taking the lead. They are taking all those calls that are coming in flood. They're calls related to utilities. They're calls related to unemployment. They're calls related to vaccinations and the frustration, not that maybe they don't know how to register, but if they even get registered, there's not enough vaccines for them yet, or being told you're not yet 75, you can't jump the line. So these are all the type of issues that Lisa's been dealing with. I'd like to just introduce her for a minute to tell you a little bit what she's hearing on the front lines, then take your questions. Lisa?
Thank you very much, Governor, and thank you for your commitment, especially to help those most vulnerable. It's a real standout in Connecticut that there is that commitment, and we're grateful to you. Governor, we have been working in partnership with you and with the state agencies since really the beginning of the COVID pandemic. And to date, Governor, we've responded to more than 97,000 calls from Connecticut residents with questions and concerns specifically about COVID-19 and seeking guidance and clarification on different policies. At the same time, Governor, United Way of Connecticut's general 211 services have also been an important part of our response to provide information and assistance to Connecticut residents at this challenging time. And just for comparison, important for people to know that compared to the same time last year, we have seen an increase of more than 530% in the inquiries we're receiving for assistance just with basic needs. So that includes a 352% increase in inquiries related to emergency food, a doubling of inquiries regarding utility assistance, an 82% increase in employment and income inquiries, and about a 70% increase in inquiries related to assistance with housing, shelter, rent, and mortgage. So, we just really want to ask of folks out in the public to have some patience as we try and do our very best to respond with empathy and with full information to every inquiry coming in for need. Our contact specialists are doing great work every day, but it is a high volume. And so we're proud to work together with state and federal resources and with our nonprofit partners across the state. But there is a high volume coming in, and we're doing our very best. Governor, I might leave it there, and I'd be glad to take any questions about our work.
You got it, Lisa. Thank you. And Paul and Josh are here as well. Over to you, Max.
Channel 3 Eyewitness News.
Yes, Governor, if the emergency order is extended to April 20th, it really clashes, right, with a lot of other states with what they're doing right now. So what aspects of the order do you feel so crucial that needs to be extended right now?
I lost the last part of that.
Could you repeat the second part of your question, Matt?
Oh, yes, Governor. So what aspects of the current order do you feel is so crucial that it needs to be extended to April 20th?
Yeah, I don't know about clashing with other states, and this is something we do in collaboration with the legislature. They gave us the green light to do this back in September as well as early on. But let's face it, things are changing very fast. Could go one of two directions in terms of that super spreader variant versus the relative stability that we're seeing right now, stability in a 5% infection rate. And it's really important we be able to operate with a relative quickness. Look, we just opened up the Rensselaer Field in terms of a drive-through for vaccinations. That would have been a lot more complicated if we didn't have the executive powers necessary to get the purchasing agreements, get this in place, and now we'll be able to get 100% FEMA reimbursement on it. We've got to figure out by February 9th which of these EOs continue, or otherwise, if we didn't do the emergency powers now, they could all potentially stop in less than 2 weeks. And it's that type of a herky-jerky or back and forth, which would be really tough from a public health point of view and an economy point of view. Paul, anything you want to add on that?
No, I think, Governor, you said it correctly. And I think one thing to also add, this administration hasn't put forth a new executive order for almost a month and a half. It just shows that the emergency orders that we have in place has allowed us to, this state to function under this public health emergency. In addition to that, of the public individual orders that we have put forth, about 66% of them were to relax a restriction currently in state law, regulation, or local charter or ordinance. The perfect example, as the governor just stated, was the Rensselaer Field and setting up our vaccine distribution sites and with other sites that we're looking to set up across the state of Connecticut. So as we get closer to that February 9th date, we felt that it was imperative to provide clarity for the people of Connecticut and also imperative for us to continue the overall response that we have during this emergency.
Perfect. Thank you. And my last one, if I may, now that we're getting closer to having those with comorbidities get their vaccinations, we just wanted to see how that process is going to work. Do we know if and how this group will be vetted?
Want to try that, Josh?
Yeah. So we're still at least a month away because we're going to go from the 75 and older, as the governor said. We probably have another two-ish weeks to go there. Then we go to the 65 and above. That's likely to take another several weeks. And so in the meantime, our Department of Public Health is going to be working to further refine that list of high-risk factors that were initially provided by the CDC, as well as the list of who qualifies as exactly a frontline essential worker. That work will be ongoing in the coming weeks, and a lot of additional detail and clarity will be provided well before we get to that phase.
Fox 61.
Hi, Governor. Is there any data estimating how many more Connecticut residents are possibly carrying this new strain of the virus in addition to the 8 we officially know?
I think we're assuming that it's much more widespread than you see just in those 8. It's a pretty complicated genetic test to see whether you have this supercharged variant or not. So I think that's probably the limiting factor. We're definitely more than what we're counting right now.
And then the chart that you had up, it said a total of 308,502 vaccine doses administered. According to the CDC in Connecticut, it's 321,737. So we were just wondering why the difference in numbers.
Yeah, Josh.
Great question. I was wondering the same thing too earlier today, and we have an inquiry into the CDC to try to reconcile why we're getting different results. If they know about some group of people getting vaccinated in Connecticut that we don't know, but we'll provide more clarity once we can reconcile that with them.
And then lastly, do we have the total number of vaccine doses delivered to Connecticut as of today? Or
yes. So this week's shipments probably are arriving today, tomorrow. So as of what it was delivered at the end of what we expect to have delivered by the end of this week, including first and second doses, should be in the neighborhood of 585,000 doses delivered by the end of the week.
Thank you.
You're welcome.
News 12 Connecticut.
Hi, everyone. Lisa, this question is for you. I know you mentioned 97,000 calls related to COVID-19. How many calls have you gotten to set up appointments?
Yeah, thank you very much for that question. So I can tell you that just since we got started with the vaccine appointment assistance line, January 14th, we've had more than 30,000 calls. I would flag that some of those calls, even though they are coming into the scheduling assistance line, are really more general calls. And so we're doing our best to answer those calls as well. And we've scheduled more than 4,200 patients to date for their appointments at the Pratt & Whitney site.
And this morning, Deidre Gifford mentioned that you're going to be adding 3 additional sites that you can book for, right?
That's right. We have several additional sites that are going to be coming online to allow us direct access to appointments so that we can book callers who call into the line and need that extra help directly. So we've got a number of conversations with healthcare providers across the state who do understand that this extra avenue of access is important. So we'll be glad to provide some updates on that even later this week through Josh, if you'd like.
Do we know where those locations are going to be?
Just today, we did open up with Bristol, so we're very grateful to Bristol Hospital for that. And we are working on the fine points with some others. So I'd like to get back to you on those if I can. And we can tell you later this week what those other sites will be, and there should be more again in another week.
Great. Thanks, Lisa. And Governor, just one off-topic question for you. Tomorrow, there's going to be a big forum at the legislature about gambling expansion. Do we have a deal yet to do online gaming?
No, but we are talking. We're having good, constructive conversations with both Foxwoods and Mohegan Sun, and let's see where it goes from there.
So now, there is already a bill filed that would give the tribes more or less exclusive access to this expansion. Are you planning on filing your own bill? If so, when? What would it look like?
I'll let you know on that. But look, there are a lot of variables here in terms of number of skins, exclusivity, fees that go back and forth, physical structures, sports betting, iGaming. It's a multifaceted discussion going on, but we're making progress.
Thanks, everybody.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. Hello. It was looking like the 8 people who tested positive for this UK variant are all in New Haven County. Is sampling only taking place in New Haven County, or is it taking place across the state?
Do you know that, Josh?
Yeah, it's taking place statewide. So there is a certain signature in the PCR test result in the event that this UK variant is present. And all of the PCR tests that have that signature are being sent for sequencing statewide. So we're looking across the state.
And do we have any idea then, I guess, why they're only appearing in New Haven County?
No.
Okay. In terms of the vaccination sites, are those open to only Connecticut residents? Because we received a report from somebody that they had seen some out-of-state cars there. at Rensselaer Field?
So we have a mutual agreement with all of our neighboring states that we will each vaccinate people who either live or work in our respective states. So where we have towns on the borders where someone may live in Connecticut and work in New York, if that New York workplace is doing a vaccine clinic, they could get vaccinated in New York and vice versa. So we're trying to make it as easy and frictionless for people to get vaccinated, regardless of where they live or work, but they have to either live or work. So we're not going to entertain people traveling in from other states to be vaccinated. So it has to be either live or work in Connecticut, and that's the same in all of our neighboring states.
And finally, Dr. Fauci was talking today about this idea of double masking, where sometimes people will wear a cloth mask and then a surgical mask together. He thought there might be some benefit to that. Is that something the state, is considering at all? Is that something that potentially could make its way into rules?
I'm not sure it's going to make its way in the rules, Matt, but if Dr. Fauci says, look, for a certain coterie of the population that'd be most at risk, if they wear 2 masks, that's better for them, I'd listen to Dr. Fauci.
Okay, thank you.
WTIC 1080 News.
Hi, have the IT people given you a diagnosis on VAMS, the online service? What's the problem with that? Too many customers?
Josh, tell us about VAMS.
So I'm not quite sure what you're asking. I mean, I think that the concerns we've heard about VAMS is that it may not be as intuitive for people to figure out how to kind of click their way through the workflow. So it's a usability question. And we have a number of areas that since we first saw the system, a month ago, that we've been working with CDC, and they have been making improvements. It's actually been getting better. We have a roadmap list of suggestions. We'd like to see them continue to improve on it. But if your question was implying that somehow the system hasn't crashed or anything like that, it's hard for some people to use, and especially people who aren't comfortable, shopping online or banking online. And we recognize, particularly in the 75 and above group, there are a lot of people who fall into that category. That's why we partnered with Lisa and her team to ensure that people have a way to call on the phone. It's why we've embraced a number of our hospital systems who also set up their own phone lines and who've been doing outreach to their patients in their database. And it's why we're partnering with local health departments, other community organizations who are also doing direct outreach to seniors who may not be as comfortable, or helping them walk through the VAMS workflow. So there's a lot of different ways that we're working to make it easy as possible, but all it boils down to at the end, when you get through that, is that there just aren't enough appointments for all the people who want to get vaccinated right now, and that's really the root cause of a lot of the frustration that's out there.
Think that system will work as you process hundreds and hundreds of thousands of younger people as time goes on?
Yeah, again, it's not a scalability issue. It's a usability issue. So frankly, as you start getting to people who are younger, who are more comfortable with technology, you'll hear less complaints. That said, we are working to make it easier to use and to improve the process end to end. So that work is ongoing.
Connecticut Public Media. News 8.
Thank you, Max. Good afternoon, everyone. Governor and possibly Josh, we talk about the 4 additional residents testing positive for that variant. You can talk to everyone about being more vigilant as this gets worse. And Governor, I think you said it perfectly, a race against time. In addition to people trying to do more and to stay vigilant or be more vigilant, is there anything that comes to mind, or what are the types of things as this gets worse with this other variant? Are there other things that the state can do, or other ideas to try to pass along?
I think more of the same, just double down. I think the more you limit your coterie of folks you hang out with, the much less risk that you run into contact with this super contagious variant right now. I think, outside much better than inside. Keep those distancing, the masks. I think nothing has changed in terms of what you ought to do. It just makes it all the more important to do it. And it makes that vaccine all the more important. We get those shots in the arm.
To get off topic for a second, And I know that obviously the administration has only been in for less than a week, but one of the things you had pointed to before about possibly with President Biden funneling more aid to states to kind of help and maybe keep having to raise taxes. Do you have a target date when that could happen, or have you heard anything in terms of those, whether that aid will be coming, and if so, when?
I think the only thing is risky is betting where COVID's going to be in a month, is betting what Congress is going to do in terms of the next round. I do know that it's the president's priority. I do know that he said, in particular, U.S. Senate, don't let anything delay us getting this next round of aid out there. What it means in terms of vaccination, what it means in terms of small business, what it means in terms of stabilizing our respective state economies is that important. That said, there are a lot of moving parts.
The Associated Press.
Thank you, Max. Good afternoon, everyone. Governor, I'm not sure if you can answer this or not, but I'm trying to find out what's happening with vaccinations for uncompensated caregivers. At one point, it sounded like the issue would be discussed by the allocation subcommittee, but then it's not on their agenda for tomorrow. This seems like a really big concern for some families.
You want to try that, Josh?
Yeah, I know that the allocation committee did discuss that and decided at this point not to prioritize uncompensated caregivers in phase 1B. Obviously, the people that they're caring for, if they're 75 and above, or soon to be 65 and above, they would be prioritized. They get vaccinated and then they're protected. So I think that was part of the logic on the guidance that they provided.
Okay. And do we know at this point how many nursing home workers and how many assisted living workers have received at least one dose so far? And what percentage of the workforce now has received at least one dose? Or even
Yes.
two, how many have gotten both would be great.
Yeah, we had over 66,000 doses administered to people in the long-term care program. That's 53,000 first doses and another 13,000 second doses. I can get back to you, Sue, with the split out between staff and residents in that number.
Okay, thank you for that, and if you could. And are you still concerned, though, whether or not there's enough people that are workers that are agreeing to get vaccinated? Is there still hesitancy out there?
There is, but we've been doing a lot of education and outreach. The facilities have, our partners in labor and others. And what we've been hearing is that as CVS and Walgreens come back around for the second clinics, they have been seeing some of the people who passed on the first clinic agreeing to get their first dose on the second clinic, knowing that there's then a third clinic to come where they can get their second dose in the third clinic. So it's improving. And I think what we're seeing, and we'll see this across the board, is that the more people who get it, the more people who will be ready to get it as well, as they see their friends and their peers and their coworkers, getting protected.
Okay, thanks. And Governor, regarding extending your executive orders, will civil immunity protections for nursing homes be among those? If so, why?
The answer, Sue, is we're going to take a look at that. But the reason why would be, given the new variant strain of this COVID virus, super infectious, what risk that may be in congregate settings like nursing homes may mean that in order to keep them going, keep employees feeling confident that that type of immunity makes some sense a little bit longer.
Okay, thank you very much.
Thanks, Sue.
Hearst, Connecticut Media.
Hey, good afternoon, Governor. With the 4 new cases that were announced today, are you at all concerned about increased virulence? I know the UK had discussed that. And if so, do you foresee reverting back to any tighter restrictions based on that?
I sure hope not, but I am concerned. Look at Britain. I mean, nobody was more casual than Boris Johnson, and they're in a lockdown right now, given the highly infectious nature of the UK strain. And right now, they've been in that situation for, a month or so. We tend to be a month or so behind them. We see some minor evidence at this point of that highly infectious strain here, But that's why we got to stay relatively nimble. But I hope that we dodge it. I hope we catch up and the vaccinations protect us.
And then kind of on a different tack, I know the fall's often discussed as the point when, or sort of sometime in the fall is discussed as the point when life could kind of get back to normal. Is there a specific percentage of the population getting the vaccine that you would see as the tipping point for that? And would you take the number of people who have had the disease at this point and recovered as part of that calculation?
I think less the latter, because I don't quite know what that means in terms of immunity. Look, Dr. Fauci said, 80% plus of folks, say folks over the age of 80, vaccinated, or at least they've had some severe infection. That creates a sense of herd immunity. And then, working in my role as chairman with the Governors Association, trying to work back from September 1 and see what are the number of doses we need in a state like this and across the country in order to get us to that 80% herd immunity.
And then thanks. I know this has been asked a couple of times, but do you have a number on how many people got the vaccine early who were ineligible when they got it?
I've heard Josh postulate that I think it's very, very small, 1 or 2%. Maybe there's some guys who are, jumping ahead of the line. I think a lot of it was sort of inadvertent. We've been doing a lot of vaccinations in a fast start and trying to explain as best we can. I don't think it's really a big problem, at least not in Connecticut right now.
Thanks.
The Connecticut Mirror.
Thank you. The number that you gave out for the 75 plus, is that only people 75 or older who got the vaccine in 1B, or does that also include the people in 1A in the nursing homes?
Includes the folks in the nursing homes of that age as well.
Okay. And do you have a number within the healthcare, not just nursing homes, but hospitals, the percentage of employees who have declined the vaccine?
In hospitals specifically, Paz?
Yeah.
We don't have a precise number, but what we've been hearing anecdotally from the hospital leadership is that percentage has been shrinking pretty consistently, and at this point, most of them think that they're up around 70%.
You think that you're up around 70% of staff accepting it?
In the hospital systems, correct.
Okay. And how about in the nursing homes?
We think it's lower there, but as mentioned before, it's continuing to creep up. Again, somewhat anecdotally, we think it's north of 50% in the 50 to 60% range at this point.
And how aggressive is the state in trying to track that? That would seem to be an important data set for you guys.
Yes, we continue to seek additional data from the industry and the homes. It is more complicated than you would think it is to get data, given people coming and going, how different facilities characterize certain, non-nursing staff in and out. So I agree. It's a bit frustrating for us as well to not be able to get crisp data on that. But, we've got a lot of moving parts right now. We are continuing to chase that for more precision while we, work on scaling up the rest of the infrastructure.
Okay, and last question for the governor. What should people expect on April 20? Are you talking about this is when you will reassess, as opposed to telling Connecticut that April 20th is a hard deadline where the public emergency will be over?
Yeah, no, that's right, Paz. I assume April 1 or something, legislature will still be in session. We'll have a look at the lay of the land. We'll see where we are in positivity, see how important it is that whether we have to stay very nimble in terms of our response, or now's the time to get back to a regular course of business and have the legislature with an opportunity to weigh in on these different EOs.
Thank you all.
The Hartford Current.
I want to hear a little bit more about the process of detecting the new B117 variant, and just kind of how foolproof is this? And when we're talking about we've detected 8 cases, but there are probably more. When you say there are probably more, does that mean there might be 12, or does that mean there might be 800? Like how good are we at actually finding this variant?
Over to you, Josh.
So, yeah, so Alex, as I mentioned, in the PCR testing, there is a signature in the test results that are consistent with the UK variant. And every single one of those positive test results where that is detected is sent for sequencing. And so far, it's only been these 8 that have turned up as the UK variant. So again, we know, as has been the case throughout this pandemic, even with the widespread testing we're doing right now, we're not, not everyone who has let's say an asymptomatic case of COVID or even potentially a symptomatic case of COVID is getting tested. So it's not a foolproof net of testing out there, but what we do have good confidence in is that, we're sequencing all of the positive test results that have that telltale sign in the PCR test result. And these are the only 8 we've seen. So, look, we don't, I think to boil your question down, we don't have evidence at this point that would suggest the number is dramatically higher. I think the point everyone has been trying to make is that it would be probably a mistake to assume that these are the only 8 in the state at this point.
Right. So it seems like once this variant starts spreading, from what we've seen in various European countries, it keeps spreading and the spread is exponential and it takes over and the cases really skyrocket. And you have to kind of nip it in the bud before it even starts spreading. So would you say that we are or not at that point where it has begun spreading in our state?
I think it's too early to say, Alex. I think it's, given the sample size we have, the numbers are still very small here. They're very small in other states that are tracking this as well, but we do look across at Europe and we're cautious.
All right, thank you.
The Day of New London.
Hi, Governor. Julia Bergman with The Day. You mentioned the extra 50,000 of doses the state got last week because of how its vaccine rollout has been going. I believe that incentive was under the Trump administration. Is it continuing under the Biden administration?
I'm afraid, Julia, it was a one-shot deal. We got it for just that 1 week.
Okay, got it. And then switching gears a little bit, I know that in addition to nursing homes and assisted living facilities, some independent living facilities and low-income senior housing complexes have had vaccine clinics through CVS or Walgreens, or they have one scheduled. Are these places supposed to be eligible under Phase 1A?
Yes, those facilities are part of the what they call the Tier 2 of Phase 1A in the federal program with CVS and Walgreens. The Tier 1 was the nursing homes, and then from there it went to assisted living and some other categories like the ones you mentioned.
Okay, thanks. And for those places that, the senior living facilities that have people over 75 and under 75, when they have a vaccine clinic, is anyone there eligible?
Correct. Same as a nursing home, same as an assisted living facility.
Okay, and then last clarification is the state keeping track of all the locations where CVS and Walgreens are holding clinics, and is that public?
Yes, it is.
And where can we find that list?
Department of Public Health is in regular contact with CVS and Walgreens and could provide that list if requested.
Okay, thank you.
CT News Junkie.
Thanks, Max. Governor, the Senate President has apparently a proposal to install a statewide property tax on homes valued over $430,000. I wonder if you might, where do you stand on that proposal?
Look, as I've said a few times, I don't think we're going to need any new broad-based tax increases here in this state. I think we're going to be able to get our budget balanced for next year and the coming year. I think we can do that with a combination of rainy day fund, indoor support we get from the federal government, and our revenues continue to go up. You can't count on that, but right now, I think those three are headed in the right direction where we won't need a broad-based tax increase.
And you would consider that $430 or $1,000 threshold a broad-based tax increase?
Yes.
All right. That's it for me. Thank you.
The Waterbury Republican American.
Thanks, Max. To start off, there was a vaccination clinic at Naugatuck High School today. I believe Waterbury Hospital was running it. They were supposed to get, I believe we were told, 100 doses of vaccine. They received 93. We've been getting calls from folks who were in line and did not receive a vaccination. They're upset. They were upset not getting the vaccination, and then they were upset because apparently they weren't given another appointment. One, can you tell us the situation? What happened there? And two, what recourse? What should people expect who were in line but did not get their vaccination?
Well, it must have been a Moderna clinic, because Moderna is the only, it ships in quantities of 100. The trays of Moderna vaccine come in quantities of 100. There's no such thing as 93. So either there was some sort of shipping defect, or maybe somebody dropped a vial and broke it, or, it's the first time hearing about it. But we would certainly encourage the provider to work with those people who were not able to be accommodated to book them in as quickly as possible. You can understand the frustration that would result from that, but that sounds like a one-off.
Okay. And while I got you, Josh, we heard a lot today, at least I guess for the first time for me, at least to my ear, people were talking about shipments of first doses and second doses. So are we getting multiple shipments in terms of these are first dose shipments and second dose shipments? I mean, 46,900 first doses, I believe, we're receiving weekly. So does that mean we're getting an additional amount of second doses?
That's correct. So this is something that the federal team has done well, is that they have been delivering like clockwork the second doses that correspond to the number of first doses that were delivered in the case of Pfizer 3 weeks ago, or in the case of Moderna 4 weeks ago. That's the prescribed period in between first and second doses. So that's exactly right. Those have been getting delivered, like I said, like clockwork, on time.
And I think you mentioned, I think it was Sue's question, something about 525,000 doses have been received? Around there? 500,000? Is that?
By the end of this week, we will have received deliveries of 585,000. And where you're going with this question, Paul, that's made up of 398,000 first doses and 187,000 second doses.
Okay, thanks. I really appreciate you clarifying that. And I guess this is also a question for you as well as the governor. The CEO of the Connecticut Paid Leave Authority put out a release today saying that only 40,000 of the estimated 100,000 businesses in Connecticut have registered to start deducting 0.5% of weekly pay from workers' paychecks to support the paid family and medical leave insurance program. I'm just wondering what your thoughts are on that. And it seems like a lot of businesses that haven't stepped up yet.
Yes, definitely more work to do to continue to get the word out there and identify those businesses and make sure they're getting enrolled and in compliance with the law. But
the point in the release was that these businesses, one of the major points in this release was that these businesses will now be limited in what they can retroactively deduct from employee paychecks. So I don't know if that is an issue in terms of solvents. I wouldn't imagine it is, but what other penalties might they incur for not doing this, if any?
Yeah, it's a question, Paul, I'd encourage you to direct to Andrea Barton-Reeves over at the Paid Leave Authority. She can step through that. But look, I mean, this is a brand new program. Everyone has expected some growing pains as we roll it out. And the team over there has done a phenomenal job of standing this program up from scratch in a very aggressive timeline that was handed over by the legislature. And they've done a fantastic job. But there is a lot of, as you point out, Paul, there are a lot of businesses out there. There's a lot to learn. There's a lot of communication and work that's required to get into compliance. And I know the team is working hard to achieve that.
Governor, if you could share your thoughts on that, and then that'll be it for me.
Yeah, my thoughts are we could have used paid medical leave this year, especially early on, especially when people were a little reluctant to go get tested, reluctant that they might test positive, have to quarantine, and they'd have to not get paid. I mean, so I think we've been reminded in no uncertain terms how important the paid family and medical leave is. I think it's off to a reasonably good start, but you're right. If there are some companies that are slow to sign up, we're going to get them signed up. Let me just say one other thing. Yesterday was a nice break for me. I'm a football fan, and so I had some fun, good fun for the first time in a while, and I love those games. And I was thinking a little bit about Connecticut as I watched those games because, you know, we've been playing defense for a long time, and those were pretty good defensive football teams yesterday too. But as when I was standing there at the air runway at Pratt & Whitney, as I saw Rensselaer Field behind us, I saw those cars lined up. I see how charged up everybody was with the opportunity to get their vaccine. It was nice to see Connecticut playing offense on COVID, and I think that's how you win games. So that was a small step towards winning a big game. There's a lot of speed bumps along the way. This super contagious variant has got us anxious. We're watching that carefully, but I think we're on a winning streak. Thanks, everybody.